Hello everyone. Hi. Today's topic of discussion is postpartum contraception. So we are going to talk about the different ways in which we can avoid getting pregnant, and we will be having with us Dr. Abhinaya. She's an obstetrician and gynecologist. So she will be joining us to address all the different questions that we have in regards to this topic. Hi. Hi.
Hi Nilofar, how are you?
Hi, Dr. Abhinaya.
Hi.
Hi, Dr.
Happy Sankranti. Yeah, I can hear you. Can you hear me?
Yeah, better now. How are you?
Yeah, I'm good. How about you?
Good. I'm doing good too. It's nice to have you with us joining again. Thank you so much for joining us.
Yeah, it's my pleasure to tell me.
I'm just trying to add Vidya. Just give me a moment.
Yeah.
Yeah.
So how is the COVID status in your place like?
I currently right now
Hey,
I am in. Hi, Vidya.
Hi Vidya, how are you?
hello. I'm fine, Dr. Abhinaya. How are you?
I'm
Yeah, and yeah, happy Makar Sankranti to both of you.
Hey, happy
thank you.
Makar Sankranti. Okay.
Yeah, so
Yeah,
let's get started.
COVID is like everywhere. I'm just like listening so much about it. In fact, we were suspecting even Vidya was suffering with the same thing. She's not well
Okay.
actually.
Yeah,
I think she has been masked up for past 4 days now. Today is the fifth day when,
yeah,
like today after 4 days, she's seen without a mask.
yeah. I feel so different actually. Something is missing.
We are living with the masks.
Yeah,
How are you feeling now? You're good? How are your symptoms?
yeah. Actually, after 2 days, I don't have the fatigue is there. I don't know when it will go, but I'm much better than the previous days.
Okay.
Yeah.
What about your place, doctor?
Yeah, in Hyderabad, so the cases are increasing rampantly. So everybody, please take care. Please wear your mask. If you haven't got, and can't believe there's still people haven't taken their first dose of vaccine. So please take your vaccine if you haven't taken them. The people who haven't taken the single dose, they are the most affected. So
I
please go.
took two. I took two
I
complete.
got got the,
Yeah.
but the severity doesn't
Uh,
protect you from getting COVID,
Yeah.
but very less
true.
severity of the disease.
Yeah, I can feel it actually.
Good.
Yeah, let's start with our session. Okay, I'll
Yeah.
have the first question for you, Dr. Abhinaya. So today's topic of discussion is postpartum contraception or contraception in general. Is there any difference between after having a baby, opting in for some, some contraceptive device and before having baby? There's no difference between the two, right?
Not mostly the convenience of the patient and the different options and guys because it goes
Your
inside the
Yeah,
doctor, your voice is breaking.
yeah,
We cannot.
yeah.
yeah.
If a woman has at least a single child, then we go ahead and advise them to take and device also. So it mainly depends upon the patient's choice.
Okay.
Hmm.
So yeah, the first question I will have at you is, what exactly is an intrauterine device? We even I've heard about IUD, but what exactly it is?
Yeah. Intrauterine my voice breaking still?
Yeah.
Yes, yes.
Yeah, just give me
Yeah, sure. Meanwhile, if anyone have any questions, please do post it in the comments.
I'm the connections are bad here.
It's better now.
Okay,
The
yeah.
sentence
Yes.
connections are bad was like it was very clear.
Yeah.
So maybe it's because of the fan which was on. So am I clear
Yes,
now?
yes,
Audible?
yes.
Yes.
Yeah. Okay. So intrauterine device is nothing but a small T-shaped device
Mhm.
that goes inside the uterus. That's why we call it intrauterine device or intrauterine contraceptive device
Okay.
because it's contraception also. That is, it prevents pregnancy.
It's the same
Mm-hmm.
thing that is called as copper T, right?
Yeah, intrauterine devices can be hormonal and non-hormonal. So copper T is something which doesn't contain hormones in it.
Okay.
Okay.
Okay, and when we are the copper this T-shaped device with hormones, then we call them hormonal intrauterine devices. So if you have
Okay.
heard about Mary, it is impregnated with progesterone hormone, so it is a hormonal intrauterine device. The other one we have is copper T, which has copper woven around its stems. So it is a non-hormonal intrauterine device.
Okay.
So when do you, I mean, when to use which one?
Yeah.
How do you suggest that?
See, mainly copper T mainly for contraception.
Mm-hmm.
So there are coppers. The I told you the copper is woven around the T stem of the copper T, and it slowly releases copper inside the uterus, and it prevents pregnancy. It doesn't. It acts as a spermicide. It doesn't allow the sperm to pass through, and it
Mm-hmm.
doesn't allow the pregnancy to plant on the uterus. That's how
Okay.
it prevents pregnancy. So if any patient is mainly looking only for contraception, that they don't want to plan a pregnancy and want something to prevent pregnancy, then we go ahead and advise them copper T.
Mm-hmm.
But if the patient has bleeding problems, like if she's having heavy bleeding, irregular bleeding, that is affecting the quality of life, and prolonged bleeding, like she's bleeding for more than 15 to 20 days in a month, and
Mm-hmm.
after evaluating the causes, if we feel that only hormonal imbalance is the main cause, then we go
Okay.
ahead and advise after the medicine. You know, with medicine, they need to keep taking the medicine every day and they need to take them on time so that hormones act properly. So
Mm.
it may not suit all women who are like busy working and having their families, and there will be failure of medical management in such cases. Then
Okay.
we advise them Medina because once placed, it acts for 5 years.
Okay.
Okay.
Okay, and it
So,
prevents pregnancy.
okay. Yeah, that was my next question.
Yeah, if the patient has bleeding problems along and they want contraception also, we advise that patients may. If they only are looking for contraceptive benefits, we can give them copper T.
Okay. Okay. So cost-wise also, copper tea is reasonable. I mean,
Yeah,
budget
copper T,
friendly.
and there are copper teas which work for 3 years and 5 years, depending upon the type you are using. It will come for around 70 or something.
Okay.
Mm-hmm.
But when Marina, you are like 4 to 5 thousand. But it acts for 5 years, and the benefits it provides is also more, right? It is
Yeah.
preventing your heavy menstrual bleeding and all.
Yeah, definitely. Just to give, let everybody know, I mean, so that we'll know the
Yeah,
difference. Yeah. And any side effects of copper tea, I've heard, even my mother, when she had used copper tea, she said she was bleeding a lot during her menstrual cycle. And even my doctor told me that if you, I mean, if your mother is going had that problem, you might have to think of, using this copper tea. So what is your suggestion on that?
yeah. Yes, people do complain of change in bleeding patterns with copper T. That is there. And see, when you're putting something inside the uterus, it's a
Mm,
foreign body to the uterus. What uterus feels that there is something new coming inside my body and it tries to expel it. And there are some
okay.
changes coming. All this can cause changing bleeding patterns. Some patients experience the next cycle be more painful, and they can also have heavy bleeding.
Mm-hmm.
And tell them this is expected. Okay, we
Okay.
ask them to give 1 month for the copper T to settle in,
Mm-hmm.
and we cover. medications for the pain and excess bleeding.
Mm-hmm.
Also see them after the first cycle after the insertion to see that property is in place. Because
Okay.
if the pain here and the cramp here, we have seen cases sometimes the property coming out also gets
Okay.
expelled. That
Okay.
can also happen.
But
Yes,
we'll
it
not
can.
realize. But
Yeah,
will the woman realize that it is expelled?
that's why I call and check them, right? I call and see them, like we call them after the first cycle, after insertion, and we check if the property is in place.
Yeah,
So
no,
if you have an
before you say, okay,
so if
sorry.
you have an idea, the property at the end it comes with small strings.
Okay.
So leave little strings outside the cervix.
Mm-hmm.
So even you can check them whether the property is in place,
Mm-hmm.
and doctor also calls them. I told you after the first month, after her first period, and we call the patients every 6 monthly or 1 yearly,
Mm-hmm.
check that the property is in place.
Okay.
So
Okay.
sometimes it can fall off and you may not recognize that. That
Okay.
can happen.
Right, that's a risk because then like there are chances of like a conception, right?
Yeah.
Yes. So
There is a
you can do
question here.
that.
No, please go ahead, Dr. Abhinaya. Yes, yes.
So what we usually tell the patients are at least monthly. You just choose maybe in the first week of a month or so, and just check that you can feel the copper threads or not.
Okay.
So if you
Okay.
don't see them, the doctor. Sometimes what happens is not only expansion, sometimes the threads get coiled inside. The copper will
Okay.
still be in place. Okay. So if we don't see them on visual inspection after special examination, we also sometimes do a scan to confirm that it's in place or not.
Okay.
Okay. Okay.
So it's not just you get the property inserted and go home. You need to be checking them,
Yeah.
and you can reach out to the 6 monthly, 1 yearly, so that check that it's in place. And there are cases where the property gets misplaced and it gets embedded in the uterine cavity, whatnot. All this can happen, but they
Okay.
are very the benefits they provide compared to the other methods, like if you're taking OC pills, you need to take them every day, and they
Mm-hmm.
are hormonal. Don't want any side effects of these hormones, then you
Yeah.
can go for pump. So maybe the first month you can identify like if any heavy bleeding is there, then you'll settle down. It should not be a problem. If you
Mm-hmm.
really have a problem, removal is also very simple.
Mm-hmm.
Like you and we put to take an artery forceps and remove it. It is
Okay.
just an OPD procedure. I just want to mention
Yeah.
here. There is no need of any anesthesia or any big setup to do this. We'll just make sure that we'll use some sterile instruments and we just insert the property. And if you want to remove it whenever you want, we can just pull it out.
Okay. It's
Okay.
completely non-surgical.
Definitely. It's just an OPD procedure, outpatient procedure.
Okay. There's a question here before, it just goes off. I wanted to read. Any precautions required during intercourse if delivery has occurred through C-section?
Not really. Just make sure if you're not planning pregnancy anytime soon, use some other contraception, because if you're breastfeeding exclusively, there is no chance of pregnancy. But if the breastfeeding is intermittent, lactation is not proper, you don't know when the ovulation can happen, and there is a chance of immediate pregnancy.
Mm-hmm.
So you take your time off for 5 to 6 weeks until the postpartum malokia, everything comes down, and you can have it.
Okay. And how safe is to use menstrual cups with when IUD is being used, doctor?
Yeah, most of the people ask us this question: how safe is menstrual cup with an IUD? So, just previously we would say it's perfectly, absolutely safe to use menstrual cup with an intrauterine device. But some studies have shown that if you are using menstrual cup with an intrauterine device, and the chance of replacement and all. Okay,
Okay.
so what we can make sure for this, we can you tell your doctor that what method of menstrual hygiene practice you're following,
Mm-hmm.
and so that the doctor makes sure that the threads are small.
Mm-hmm.
So what happens is the intrauterine device is inside the uterus, and you're
Okay.
putting the menstrual inside the vagina, right?
Yeah.
So be careful that when you're manipulating and putting the menstrual cup, you're not pulling off the threads of the intrauterine device.
Yeah. Yes.
And when you're putting the cup, make sure the threads come inside the cup, not
Mm-hmm.
at the rim. So when you're
Okay.
pulling again, you're
Mm-hmm.
putting the cup out again, so it doesn't get displaced.
Mm-hmm.
These are the factors you need to be taking care, and also the doctor can cut the thread short if you're using a menstrual cup. So
Mm-hmm.
all these precautions can be taken, and you can use the menstrual cup, but in the right way. That's all. It's not that you should not be using the menstrual cup.
Okay.
Okay, but we have to take care, in not pulling out the string.
Yeah,
But sometimes it's
yeah.
difficult. Yeah. When we are just
Just
getting used to menstrual cups, yeah.
use, yeah. Just be aware of that fact, and you use the right size of the cup, not very big one, very small, a small one, and you're manipulating so much inside the vagina. There are threads there, and you're just accidentally pulling them off.
Yeah, that's true. So, yeah, and just another question popped up in my head. So will the intercourse be painful if IUD is being used?
No, it should not be. It will
Okay.
absolutely be normal. So immediately, like because we put the cervix and put it inside the uterus and all, you can feel little lightheaded immediately after the procedure, but
Mhm.
you will absolutely fine
Mm-hmm.
once the Intrauterine device is inserted, and you should not feel any pain. And if it's properly in position, you should not feel any pain. Your intercourse must be same as like any other intercourse, not that something inside the uterus and all. But make
Okay.
sure, like if you have fibroid uterus, or you're suffering from endometriosis, and you already have adenomyosis, which are a painful conditions, and
Mm-hmm.
the position of the property or vagina is not properly inside the uterus, then you can feel pain.
Okay.
Otherwise, you
Yeah, and actually, even though there is, I mean, so many advantages of copper tea, many people or many friends whom I've spoken to are, worried only about the bleeding, heavy bleeding during the menstrual cycle, and they said condoms, my husband, I mean, our partners can use condoms instead of why should I insert this, copper tea? So, what is your suggestion or take on this, doctor?
see, compared to comparing condoms and intrauterine device, the failure rate is high. There are a lot of
Okay.
slippage
Mm-hmm.
problems, and the condom should be worn at the act of the intercourse, right? It
Yes.
depends. It's not that it's inside your body, and sometimes it may not be available, or you
Mm-hmm.
don't have the time to, and you are just in the mood and you don't wear it. So this mishaps can happen. But
Mm-hmm.
once the copper side, it's there, like until
Mm-hmm.
you get it removed. So the chances of failure are more with condoms than intrauterine devices. And it's not that if someone has pain, you also have it compulsory, right?
Right.
Yeah.
So, so please talk to your doctor. They are the
Mm-hmm.
best people to advise, and your friends, because they tell the stories of they don't have the property. They hear some stories from their friends. Just passes through.
Right.
Yes.
Okay. But just please talk to your doctor. They are the best people who can tell you like this is the method which best suits for you, and they can give out the options, and you can choose whatever suits for your lifestyle also.
Mm-hmm.
So yes, patterns are observed with copper tea, but not with everyone.
Okay.
Okay. So
Yeah, you can
after
definitely.
the okay, so after the removal, if they want to conceive again, that will be not a problem at all.
The reversal of reproductive, it is very like the next cycle only you can come.
Okay.
Yeah, I
Okay.
just had
So
one question. I just had one question. Since we were talking about like, menstrual cups and like, the threads getting stuck in the rim of the menstrual cups and, maybe like, the positioning of the IUD may be affected. So, having intercourse is not going to affect the positioning, like, it's not going to interfere with the positioning of the IUD at all. So that is a big no, right?
yeah, no, having intercourse, it doesn't displace.
Okay.
See, because there's with the cup, you are going and pulling the cup again with your hand, right?
Right.
During that time, if threads get stuck and you are accidentally pull the IUD, then it moves, or else no.
Okay.
During intercourse, like the threads are very soft, they just sit inside the vagina. They are not that they move with the. or something.
It's cup is
Doesn't.
because of the friction. Like maybe like if something gets stuck in the rim or the edge of the cup with friction,
Yeah,
it may come out, right?
you have a manipulation because you are putting your hand inside and again pulling it.
Right.
If accidentally the rim and you just don't see it
Right.
properly and you go inside and pull it accidentally, it may come out. That's all.
Okay. Okay. Uh, I don't have any other questions. So are there any disadvantages of copy other than this heavy bleeding? I mean, till it sets.
Yes, and there are chances of very minimal chances of infection, but every doctor covers you with antibiotics immediately after the Intrauterine device is placed. And sometimes there can be chances, very, very rarely, in placed.
Mm.
And pregnancy can, like in
Yeah.
100 people, one person can become pregnant with copper
Yeah.
T in situ also. Is when it gets displaced or misplaced or pill that you don't know or lost IUD also. Sometimes we have found trend devices in the abdominal cavity also. We insert it inside the uterus, but they get displaced, and yes, this also happened, but it's very, very, very rare. So this can also, and very
Yeah.
rarely
Yeah.
it can
Please go.
perforate. These are the
Okay.
disadvantages, but the increased bleeding pattern is the most commonly observed. All of the things are very rare, absolutely rare.
Anything else
Okay.
apart from IUD, do you recommend, doctor? Like for contraception?
See, contraception, I will tell you what are the options we give to the patients. There are OC pills, they prevent ovulation and they prevent pregnancy. So you take them continuously for 21 days, give 1 week gap, and start the next cycle. And depending upon the hormones, they can estrogen plus progesterone or only progesterone containing pills. So side effects with low dose pills are very minimal. That is one of the options. The second one will be intrauterine device, what we spoke. There are properties and there are marinas. And I told you property, contraception, marina, it acts as contraceptive and also it can correct your excessive bleeding as well. If you have any hormonal imbalance, that can be corrected. Then next, what we have is an implant called Implanon.
Implant.
Mm-hmm.
It's a small 3 to 4 centimeters. It goes in your hand. We put it
Oh.
subdermally, just
Mm-hmm.
beneath the skin. Okay. Once placed, it acts for 3 years.
Okay.
So this doesn't go inside the uterus, and there is don't no need to check their threads and all. They can just feel it on their hand, and it
Okay.
contains only the hormone. So anyone who is having estrogen is contraindicated, so they can take this, and it makes the cervical mucus thick. It prevents ovulation, and that's how it prevents pregnancy. This is one other option we give for the patient. And there are injections also, but they're not much popular. You need to take the injections once every 3 months.
Mm-hmm.
But what happens is there is increased bone mineral density loss with the injections, and the return fertility may take 1 year.
Okay.
So we don't recommend injections. Depot medroxyprogesterone injections, DMPA injections are available, but we are not recommending for the patients. These are the options I give for my patients, and depending upon the lifestyle and all, I ask them to choose. So remember that when you're using intrauterine devices, they are only preventing you from pregnancy. There is
Yeah.
no protection sexually transmitted infection. That is very important to note. So anyone who is sexually active at an younger age or the chances of multiple sexual partners, make sure you use condoms also, because STDs can cause a lot of impact later. They can cause infertility also. So it's if you're choosing this option, make sure that you use a condom also to prevent STDs.
Right. That was very important point. Yeah.
Yeah.
I was. I actually when this copper tea when I was pregnant, okay, this copper tea when I heard of this name, I was imagining something like T shape, how they'll insert tea. Then
No, it's T
huh?
shape only.
No, it is T shape, but it will not be in T shape when they are inserting. It will go and I
It
was
will,
like, yeah, I
and
was like, how come?
the device, uh, it is very soft.
Yeah,
It's
I
very,
saw that.
yeah. It the two stems will be folded and it will be inside one rod. We just put it inside and remove the thing, plunge it.
Yeah.
And
Yeah, I saw a video. Then I realized, oh, okay, like that. I was always thinking how this T shape is going to go there. But yeah,
it's really made to put inside the uterus so that it doesn't slip off, right? The two T stems will be there and it doesn't slip off.
Yeah.
right, right. Yeah.
Yeah,
Okay.
one more, kind of a myth I can say that I've heard from most women, or even if you just browse across, you'll find this very commonly. Hey, hi.
Sorry, my lifestyle.
Okay.
Yeah, please
Yeah.
continue.
So usage of any of the contraception methods, say if you're consuming pills or I'm not like mainly about the pills. So people are having this myth that it'll help, it'll kind of like make them gain or put on weight. So is that in any way true? Is it scientific or it's just a myth?
No, no, because with pills we are talking about hormones, right? Progesterone can cause little amount of weight gain, mood changes, all this can happen. But with the very low dose pills, we are not happen. But we never know how we react,
Okay.
right? If every
Okay.
the same dosage may affect some people and it may affect some people. So that's why if we start them on pills, also we make sure we see them after the first month and after 6 months. We want to know if they are having any side effects of the pill. When we write side effects, we write all the things which it can cause. It doesn't mean that everything will happen to you,
Okay.
but make sure that we talk to the patients if it affects them anyhow. And also we should not blame only the pills. We should also think about our diet and lifestyle, and how maybe that can also be the cause of the weight gain, not just the pills. Yeah, yeah. And
Yeah, and there is,
yes, it can
yeah,
happen.
but
Weight gain can happen.
there is also, some side effect. I'm not sure. Correct me if I'm wrong. That menstrual cycles may not be regular, that, like before, if we are taking pills. I mean, birth control pills. Is
No,
that no?
no.
Okay.
Pills make cycle regular. If you have heavy bleeding, it will decrease the bleeding.
Okay.
It will protect some type of cancers. Someone
Mm-hmm.
is asking a question. I'm a breastfeeding mother. Is it okay to take pills to avoid pregnancy? Yes, if you're breastfeeding, you will only be given progesterone only pills. So it's safe to take them when you're if you want to avoid pregnancy. And intrauterine device is also safe during pregnancy.
Okay. Thank you.
Okay.
Thank you, doctor.
Yeah,
Yeah,
and so yeah, so we covered almost all the questions, and
yeah.
yeah, I think I'm done with my questions. If any of your our viewers are having any questions,
There was
please
one
do
more
ask us.
question. It just passed by, slipped by. I'm not able to get it back again. I'm not sure. It
Okay,
was
I,
just before the question Dr. Abhinaya read, right? It was just before that.
is it?
Yeah.
Actually, I'm not able to see any questions. I don't know why.
Yeah. I think
Only one I saw.
I don't remember the question as well. So yeah, that's okay.
Uh,
I think I'm done with
So
all the questions from my end. Yeah, Dr. Abhinaya, you're saying something?
it end up, I just like to say that intrauterine devices, just please don't think that it can happen to everyone. And if it happens also, it will settle down in 1-2 cycles. And make sure, because it is a busy lifestyles, if taking adult and you please think of Copperty or Arena. So Copperty once placed it acts for 3 years, and there are some devices which acts for 5 years also.
okay,
Arena, if you're having bleeding problems, it will help also. And sometimes, like with Arena, your bleeding become very light, and sometimes you may not have bleeding also. That can happen.
Okay.
Just want to tell you. And sometimes you can have bleeding once every 6 months. So if you have anemia, like increased red loss which happen, that can get corrected. Your cycles can get corrected, and it acts as contraception also.
Okay.
So these are the advantages of IUDs. If you have any liver disease or increased tendency for bleeding or allergic to copper, or if you're having Wilson disease, please don't take any property inserted. So please make sure you inform your doctor of this, or else these are pretty safe, and it is like once placed, it acts for 5 years, and you can get it removed very easily. Be very convenient.
Okay.
Okay, one last thing. So, doctor, from your for your means your personal suggestion, pills or copper tea? I mean IUDs. Which one would you suggest?
It depends upon the patient. Okay, if she is unmarried
Hmm.
and if she's sexually active, definitely I would recommend them pills. Then
Okay.
go put it inside the uterus. If it's a married woman and she had a first child and all, and she's not looking for pregnancy anytime soon, right? It is good that you space your pregnancy at least 2 to 3 years. Then copper T would be an ideal option. And if you're still scared of putting something inside the uterus, and you have an option of Implanon also now, so just read about it,
Yeah.
and you can insert it.
Yeah.
And make sure if you're using Intrauterine device, and if you are sexually active and multiple sexual partners, condoms are a must to prevent from STD.
Okay. Thank you. I'm like
Okay.
more curious about that thing which is supposed to be inserted in the hand. I think I'm going to read a bit
Yeah.
about it. I
Yeah,
I
exactly.
thought
Next session, you can plan a session on Implanon. We can
yeah,
talk.
yeah, that sounds
Definitely.
like an interesting topic, and it's like it does not
Yes.
have that all mess of threads hanging and all the other things. So you just have something, some chip. Okay, it makes you feel like some bond or something. You have some chip inserted, and you're all set.
All and also
Like
gets
how
your work
big is
done.
the incision? Yeah, let's have a session on that. I think that's better.
Yes.
Yeah.
Injection needed in the needle. We just give it like a, we inject the
Uh,
needle and come out. That's all.
oh,
The Implanon.
wow, that sounds really nice to me. Like I'm like all
And
game for it.
that
I feel.
Do we have some barcode of something?
No, I think.
really
Yeah, I think we can plan a session on that, Vidya. Seriously, I think
Yeah.
that's really something new, some new topic. Yeah, many people may not be aware.
Yeah.
Okay,
Aware of that.
thank you so much, doctor. It was lovely
Thank you so
session.
much.
It was a lovely session, and
Yes.
thank you so much for all the information. Thank you so much.
Yes.
thank you guys. Keep doing all the good work you're doing, and happy Sankranti to
Yeah,
you.
thank you.
Thank you.
Bye.
Bye.
Bye.